Can you hear me?
Hi, can you hear me?
Yeah.
Perfect. I was just trying to see if I can get this Facebook Live going, but I don't want it to start yet, so hold on. How's your day going?
It's crazy.
Well, thank you for being here.
I'm like, oh my God, you have to stop talking, patient, because I have a seminar to do.
Well, you're doing great.
Let's see.
Well, do you want to try to share your screen just to make sure that's working for you?
Hold on just a second. Hold on, I don't want to be sharing that.
I know.
Okay, let's see. I want to be sharing this slideshow from the beginning. Okay. Can you see that?
I can. And I'll probably kick it off with my slides just to make sure everyone has the context, and I'll kick it off to you right afterwards. So.
Okay, that's perfect.
Perfect. And I'm going to, let me do this, stop live stream. How do I'm gonna get this going so that way we can get it ready. Cool, so we have a few minutes. You got a haircut?
I get it cut every 4 weeks. So
Okay.
it depends on where you see me in my 4-week transition. It's either like this is yesterday. So this is really short. No, this is 2 days ago, but I have one of those great haircuts. I really don't have to do anything to it. Like I can wake up, put a brush in it and go, which is awesome.
Very lucky. California hippie, so I need to figure this out.
I used to have the long hair that I pulled back in the thing, and then my hairdresser gave me this. I'm like, and it's funny because today I was like, oh crap, I didn't even put any makeup on.
You're fine. You're fine.
They're getting me all natural.
Great.
Oh God.
I'm just gonna tell my husband to make sure he doesn't do anything funny while I'm.
Don't be interrupting my Zoom conference.
All right. And so let me just see. Great. And we haven't done the Facebook Live before, so I think that'll be great. And then I'll share, we had some 37, 40 people sign up. And I know some people sign up and then don't show up. So what I'll do afterwards is send them the recording as well.
Okay, awesome.
Yeah.
My PR people are, I think one of my ladies, Rachel Sutherland, is going to be on.
Cool.
And so she, she takes all this stuff and does all kinds of stuff with it. So I just kind of go, I'm going to show up and give a lecture and you guys take it from there.
And speaking of PR people, one of my friends and advisors just came out with this book called Bump In. It's kind of a new pregnancy book, really well researched. Amazing. And she's writing a new book about women's health more broadly and would love to talk to you at some point once. Okay. Through Simon & Schuster, it did really well. So I'll keep you posted.
Okay, cool. That sounds awesome.
Yeah, the book is really good too. It's she's like matter of Bump In, like Bumpin.
Okay, cool.
Bump In. So we'll probably start it at just a couple minutes afterwards to give people some time to.
Okay. And when I go live, I'll take my video off so it's just the slides. Okay.
Perfect. Maybe stop it at, I don't know how long you think you'll need to walk through the whole slides, but leave like 10 minutes at the end for Q&A.
I actually talk super fast, which is one of my it's probably one of my problems is I try to slow down, but then when I get going, it's like, so I'm going to try to slow but this will probably take me less than 30 minutes to go through this deck. So I did a deck the other night in 30 minutes that was 66 slides, and my office manager's like, you're not gonna be able to do that deck in that amount of time. I'm like, trust me, I
love it.
Lots of pictures. It's not lots of data. It's not like I have to sit there and explain confidence intervals and that kind of stuff. I just have to go, this is one of the things you can consider doing.
Perfect. And it looks like we have a couple attendees, so welcome everyone. We're going to get started in maybe 1 to 2 minutes for folks to show up and get lunch or coffee, whatever time zone you're in. And my name's Corinne. We'll get started in a few minutes. If anyone wants to say hi, you can use the chat feature on the bottom of the screen. I wish Zoom had hold music is the only thing we're gonna do a dance while we're waiting. And welcome everyone who's just coming in right now. We're just going to get started in 1 to 2 minutes, letting a few folks to come in and settle in. Oops. Not now. Oops. All right, thanks everyone. We're going to get started in 1 minute. All right, and now we are on Facebook as well. All right, so welcome everyone. My name is Corinne Carmy. I'm the co-founder and CEO of Origin, and we're here with Dr. Elise Kelly-Jones. We're gonna get started right now. I'm just gonna share my screen and we'll get this party going. See if this is working. Perfect. And great. All righty, well, welcome. My name is Corinne Carmy again. I am the co-founder and CEO of Origin, and we are physical therapy designed for women and mothers. Today, we are very lucky to have Dr. Elise Kelly-Jones, AKA the Sexpert, with us. We'll have her introduce herself in a few minutes. And just in case anyone is not aware, Origin is on a mission to help women feel their best through every stage of life. So we're a physical therapy designed for women and mothers, and we treat incredibly common but often overlooked issues such as painful sex or postpartum recovery issues. And we do that both in person in our location in Los Angeles as well as online. Right now we're offering telehealth in California, New York, and Texas, and hopefully many more places soon. And so this Real Talk series is our way of also hoping to spread much more clinically informed information around sexual health, pelvic floor dysfunction, and a lot of the issues that we see so commonly, but a lot of women and men are not aware of as well. So with that, I will let Dr. Elise Kelly-Jones introduce herself. I'll just share that Dr. Kelly-Jones is an advisor to Origin, and we've been so lucky to have her support over these last few years. She's incredible, and we're in for a treat today. She's also known as Charlotte's Dr. Ruth, which I think is amazing and hilarious, and you'll hear from her shortly. She is all about real talk. And we've decided, for today's conversation to really focus on some myth busting around sexual health and desire and orgasms and a lot of the things that I think many of us grow up maybe learning incorrectly because of the misinformation out there. So we're in for a treat. And with that, I will stop sharing and let Dr. Kelly-Jones share her wisdom. And for anyone who's just joining right now, please know that we'll have at least 10 to 15 minutes at the end for Q&A. So if you have questions, feel free to drop that into the Q&A or the chat feature. And we'll do our best to answer everyone's questions either now or in the conversation afterwards.
All right, thank you. And I'm going to share my screen. I really appreciate the opportunity. I'm actually going to stop my video so you can just basically see the slides as I'm presenting them. Let me just make sure that they're going to move forward. Yes, they are. Okay. So thank you for that introduction. I'm so excited to be here and talk to everybody today about some of the myths with regard to sex and sexual desire. Just a little bit about myself. I am in Charlotte, North Carolina. I may or may not have a Southern accent, depending on if you recognize some of the words I say. I am taller than Dr. Ruth, and I don't have her lovely accent, but in Charlotte, I've kind of gotten this nickname, which is kind of fun. these are all the places you can find me or follow me or see me. But I'm an OBGYN, and I have been very interested in women's sexual health since I first got out of residency. What you may not know is that very few of us OBGYNs learn anything about sexual health during our residency. And so most of what I've learned has been after residency, and mainly through an organization called ISSWSH, ISSWSH. That stands for the International Society for the Study of Women's Sexual Health. Say that 3 times really fast. Anyway, this society is completely dedicated to the study of women's sexual health and providing evidence-based practices for women to use in relationship to their sexual wellness. So not my friend told me this or I read online this, but really good evidence-based information. And we really haven't had much evidence-based information over the course of women's health, but it is growing. And we really appreciate a company like Origin, who is deciding to kind of get outside the box of what we think is normal with regard to women's sexual health as far as their pelvic floor, and really trying to address problems even before they happen. So in pregnancy and in the postpartum period, and really trying to maybe prevent a whole lot of disorders rather than respond to them after the fact. So we're going to bust some myths about sexual desire. And then I'm going to give you some tips about spicing up hopefully your own sex life. And then hopefully at the end, I'm going to take some questions. So what you may not know is that there are really 2 different types of sexual desire. There's what I call spontaneous desire, or I also call this hot, sweaty monkey love desire. So this is when you're first, in a relationship and you have that new relationship energy and you can't wait to be with your lover. And, they're just, like you grab each other and you rip each other's clothes off and you have great spontaneous sex. And after you've been in a relationship for a while, which we all want, that's what we all want. We want to have that nice, warm, cuddly, comforting feeling that that person's going to be there when we get home or at the other end of the phone, or that they're committed to us. So we move from having what's called spontaneous desire to what's called responsive desire. And this has to do with, I may not feel like having sex. So that's what desire is. I feel like having sex until something's happening to me. So maybe I'm getting kissed a certain way. Maybe somebody's dancing with me. Maybe somebody is actually touching an area of my body that turns me on. And so we move from having spontaneous desire to responsive desire. And so many of us won't initiate a sexual encounter until our partner's actually doing something. And so if our partner never does anything, we may actually think we have low libido or low desire, but we don't. We just have what's called responsive desire. So if you look at this kind of graphically, these are from 2 thought leaders. So this one on the left is kind of the Masters and Johnson research that showed us that we have kind of these 4 phases of sexual response. We have desire, then we have arousal, then we have orgasm, and then we have resolution. And then Rosemary Basson came out with a different model of sexual response. And what she kind of said is we sit at kind of 12 o'clock in neutral. And what we really want is emotional intimacy with our partner. And then something pushes us out of that emotional intimacy phase into being kind of receptive to sexual stimuli. So I like to call these your turn-ons. And every person on the planet should know what their turn-ons are. Is that a warm, hot bath? Is that you kiss me a certain way? Or is that you put the dishes away and now I'm kind of enamored with you? And then that moves us into having some spontaneous sexual desire. But oftentimes we have to be aroused. So arousal is kind of what happens in our body before we kind of have what happens in our brain, which is desire. And then we hopefully go through the rest of the sexual response cycle. We have orgasm, and that leads us back into neutral. and having kind of that emotional intimacy. So I just kind of mentioned the word orgasms. Orgasms are important, but there are also a lot of myths regarding orgasm. And so one of the biggest myths that orgasms come from penis and vagina intercourse. The number of women I see every single day of my practice that they've kind of been shamed into thinking that, you know, they don't have the proper orgasm because their orgasm comes from the clitoris, is tremendous. And so we need to dispel this myth that orgasms only come from penis and vagina intercourse. Actually, some women have nipple orgasms. Some women have orgasms just by thinking about it, but most women have orgasms from direct clitoral stimulation. And, you know, men have this really outward sign of arousal. They get an erection. Women's arousal sometimes, or a lot of times, is more subtle, and it oftentimes can be missed by a patient. So they'll tell me that they're not becoming lubricated or aroused, and then I'll do an exam, and I'm like, well, you have really normal tissue. So sometimes we have to just put a woman in better touch with her body. And that's why this next myth is really important, that it's wrong to use lubes. There's something wrong with me if I need to use lubrication. And what I tell my patients is we all need to have a beautiful bottle of lube next to our bedside and feel like we can use it or we cannot use it. So as a speaker, if I'm getting up to give a talk and I have a dry mouth, I don't feel any problem with going over and having a glass of water. But if I'm in a sexual encounter, somehow I feel bad about going over and squirting a little lube in the situation. And I really don't think we should feel bad about that. And I think we should just let that go. Lubes come in a lot of different formulations, and these are probably 3 of my favorites. Wet Platinum is a water-based lubrication. Water-based lubes have to be applied more often. They can get sticky as they dry unless you wet them again. And you can either wet them with a spray bottle or your own moisture from your saliva. Uber Lube is a silicone-based lubes. These kind of lubes don't have to be applied as often. A little goes a long way. They're great for extended periods of lovemaking. They're also good for anal play. And then we have some of the natural-based lubes, like this one by Good Clean Love, and they make some great products. So I think all these are great things that any of us should have at our bedside and not feel guilty about using. Here's a huge myth: sex just hurts sometimes. So today I saw probably 21 patients over in Charlotte. We get started early. And I probably saw at least 5 patients with sexual pain. And I actually think it's an epidemic. And I think for the most part, we tell women that it's okay that sex hurts. Maybe the first time it's okay that sex hurts, but after that, it really shouldn't be hurting anymore. I had a woman tell me today that she had so much pain during her sexual activity with her partner that she actually ended up screaming and crying at the end, but she really wanted her partner to finish as opposed to stopping. So not only will we go on with sexual pain, but we actually let our partner have their pleasure, you know, in the face of all this pain. So I really encourage women, if you have sexual pain of any kind, go see your doctor. And if you don't get answers, keep seeing people until you get the right answer. ISSWSH, ISSWASH.org has a Find a Provider section. So if you're struggling with a sexual functioning issue and you're having difficulty finding somebody to help you, then I would recommend looking at that Find a Provider section. What you may not know is there are actually stages of your vagina. When you're young and reproductive age, your vagina is actually loaded with lots of stretchy skin and tissue. I like to call these the pleats of a skirt. So that's what a baby comes through, and that's what a penis can go in or a toy can go in. And so once we start to go through the changes of life with regard to menopause, we end up going from this nice stretchy pleated skirt to maybe not so stretchy pencil skirt. And then eventually, if we don't use any hormones and we aren't long-term having good sex, we end up with somewhat of the concrete vagina, which is very hard. Once we get to this stage, it's very hard to fix. And so we really encourage you, like I said at the beginning, if you're having painful sex, get it addressed early on. It's easier to help you. So if you've used lubricants and you've used over-the-counter moisturizers and you're still having painful sex, then it's important to go see your doctor. Things like bacterial vaginosis and yeast infections don't generally cause painful sex. So if you're being told, oh, this yeast infection is probably causing your painful sex, it's true if you have multiple yeast infections, because that can lead to a disorder where your nerves are increased, but it doesn't usually cause it the first time. So here's all types of, one of the things that we utilize every day is the help of our physical therapist. Lots of times I tell patients, I need to send you to physical therapy to help your vagina. And they look at me like I've just told them something crazy. But the physical therapists are actually like, I can make a diagnosis, and I can prescribe medicine, but they are so important with regard to helping the patient learn what her muscles of her pelvic floor do. Learn how to relax those muscles of the pelvic floor. Learning what her trigger points are and how to release those trigger points. We also have pelvic floor physical therapists that are trained to do what's called dry needling. So if there's scar tissue or points that are really resistant, they can help with that. Here's another myth. Hormones are dangerous. So every day somebody comes to me and says, you know, my menopause is miserable. I'm having hot flashes and night sweats and vaginal dryness and painful sex, but I can't use hormones because I'm going to get breast cancer. And that came out of a study that was done in 2002 or stopped in 2002 called the Women's Health Initiative. And that study was obviously published 18 years ago. And in 18 years, we learn new information. So the most recent guidelines from the North American Menopause Society, I'm getting a little ahead of myself, but the recent guidelines from the North American Menopause Society say women who are symptomatic from their menopause, hot flashes, night sweats, vaginal dryness, and who replace their hormones early in menopause, so within the first 10 years, lower the risk of heart disease, decrease the risk of type 2 diabetes, and decrease the risk of osteoporosis. Over their lifetime, they may ever slightly increase the risk of breast cancer, but do the benefits outweigh the risk for that individual patient? So many women say the symptoms interfere 84% with their life, and 12% they say, I can't really even function with these symptoms. Most common symptoms are hot flashes, night sweats, and vaginal dryness. And only 1 in 5 women actually ever see a specialist with regard to hormone replacement. And the specialists are the ones who really have all the good information and can really talk to you about risk versus benefit. So if you're suffering from menopausal symptoms and you're not getting good treatment, the other website to visit is menopause.org, and they also have a Find a Provider section where you can find people in your area that actually specialize in menopause. Here's another myth. You shouldn't have sex during pregnancy because I hear this all the time, it's gonna hurt the baby, or the baby knows what we're doing. The baby doesn't know anything. The baby doesn't know whether you're running on the treadmill or whether you're having sex. So if you can run on a treadmill during pregnancy, or you can walk during pregnancy, you can have sex during pregnancy. It can be quite pleasurable. Your hormones are the highest they will ever be in your life during pregnancy. And if you can kind of figure out how to kind of manipulate your belly in different ways and talk to your partner about different sexual positions to use, then you can have quite pleasurable sex during pregnancy. Will my vagina ever be the same after childbirth? Well, most of us think that this is not the case. And this is where the company like Origins is really helping to change this or dispel this myth. Pelvic floor physical therapy in many European countries is almost an automatic after a woman has a baby. So your baby comes through the vagina, stretches it out, or you have a C-section and you have scar tissue. And if you go see a pelvic floor physical therapist right away, you will probably long-term decrease your risk of incontinence, decrease your risk of having issues with regard to the health and wellness. You may have orgasm issues that will resolve sooner. So here's a few tips to speed up healing after you have a vaginal birth. And make sure that if you are having any long-term issues, I saw a lady today who'd been breastfeeding for 3 months, and I looked at her vagina and it looked like she was in menopause. And I said, "You're having sex, does it hurt?" And she said, "Oh yeah, it's been hurting ever since I started." And so we put her on a program to help kind of rehab her vagina. And once she stops breastfeeding, then this will all resolve. But make sure you get some proper help if you're having these issues after you have a baby. So what are some tips that I use and you can use every day to help spice up your sex life? So we're gonna move away from the myth section and on to like what can you do every day, or what can you, maybe as we go through this section, take one tip and really try to apply it in your life over the next few weeks and see what happens. So I love this first one. Instead of texting your partner, did you take out the garbage, or, what's for dinner? Maybe send them something hot and spicy about, tonight I'd like to blah, blah, blah. Or tonight I'd like to put on a sexy outfit and give you a massage. But something that's really spontaneous and sexy, maybe outside of your normal wheelhouse, but not totally outside of your comfort zone. What about role playing? So this is kind of fun. Been in a relationship a long term. You don't necessarily have to dress up like Wonder Woman, but go to a bar, maybe go out to dinner, and then kind of meet up with your partner, but pretend you didn't know each other. Maybe use different names. Maybe try to ask each other new questions that you haven't really asked each other before. Act like strangers, and then maybe go home together, kind of like you're having a one-night stand, but not really. Here's an interesting one. Watch porn together. So porn has its good things and its bad things, right? Most men learn their sexual information from pornography, and most women learn their sexual information from men. So porn can be negative in that aspect, but if you're kind of searching for new ideas or new things that you want to do, then watching some porn together may actually help you with that. And then if you're not interested in that, here's another good one. You can kind of maybe create your own erotica together. So grab a notebook, maybe a special one like this one that says Love Notes, and start your own erotic story. So one person starts writing in the notebook and the other one picks up where that one left off, and you kind of share it back and forth. Maybe you abstain from sex for that week, and at the end of the week, maybe you reenact your own steamy love story that you've been writing to each other. So this next one, does anybody else's calendar look like this? Does anybody even have a calendar anymore? Anyway, so I don't really love the idea of scheduling sex. I like the idea of scheduling some type of intimacy. So I love the idea of both partners being really responsible for intimacy and maybe trading who initiates. So maybe you and your partner decide you want to have intimacy about every 7 days. So then you and your partner will, say you went home and initiated some type of intimacy tonight with your partner. And maybe it was just really good kissing for 15 or 20 minutes. When was the last time you kissed your partner for that long? Now it's your partner's turn to initiate some type of intimacy. So it can be the next night, 2 nights from then, or 7 nights from then. But it gives both partners the ability to be in charge, but also gives the ability for the other partner to kind of relax and let that person be in charge. Here's a great one. Create a sexual bucket list. So I just took this erotic communication course, and the erotic communication course had a list of like 15 things that you could talk to your partner about sex. So maybe create a list of things that you haven't tried that you'd like to try, and go over that list with your partner and see if there's some things that they also would like to try that they haven't tried. Here's a great one. Plan a sexy scavenger hunt. So start with a photo of yourself in something sexy, and then leave a piece of clothing or a sexy item like handcuffs around the house with the next clue in it. And then that moves them on to the next clue. Maybe it's on this particular item. And then use all those things at the end of the night. So a fun thing for you to do with your partner, not that hard, doesn't have to be handcuffs and a gag ball, but it can be something fun. I love this one. Go shopping for sex toys together. So shopping online for sex toys is really fraught with difficulty. You can't touch it, you can't feel it, you can't hold it, you have no idea what it really does. You're just kind of guessing. So go to one of your local sex toy stores where you have experts who know the products really well and can help you with picking products that are good for you and your partner. The days of the sex toy shops being around the corner down the back alley are over. They're in the shopping strip mall, and you should feel very good about walking in there and getting some good advice. Here's another great one. Do something together outside the bedroom that creates some bonding with each other. So learn to ballroom dance, learn to play tennis together. How about a cooking class? Or if you live somewhere where it's cold, how about learning to snowboard together? So that creates a level of intimacy that's kind of ahead of where a lot of couples are. Plus it gives you something to talk about, outside of just let's have sex. Here's an awesome one. So if you go home and your bedroom looks like this or any resemblance of this, it's time to have the organizer lady come over and get this taken care of. So your bedroom should look like a place that you could fall asleep in or you could have sex in. So this beautiful bedroom over here is nicely laid out. There's not a whole bunch of paperwork anywhere. There's not a whole bunch of toys anywhere. And I love this idea is buy furniture that has multiple purposes. So this beautiful ottoman, you could imagine yourself having sex with your partner there, or it could be a lid and open up and all of your sex toys that you should have plenty of because you went shopping at the sex toy store can be located inside there. This is another one. This has to do with that level of communication. Never stop sharing your desires with your partner. If you want to have a good sex life, then you have to kind of work on it. Don't think it's just going to happen spontaneously. Nobody ever lost weight just by thinking about it. We put a plan in action. We may start a diet. We may go to the gym and learn to do a new activity. So that's really the same for your sex life. I tell a lot of my patients, having good sex is like a 20-piece puzzle. You have to lay down all the pieces to have a really good sex life. Send your partner a special delivery. So maybe wrap up a cupcake in here and say, bring this home and let's eat it together naked. Or maybe you put some sexy clothing in here and send that to the office and then have your partner bring that home and they can use it that night. Here's another big one to understand, that if you're on birth control pills, 100% of women who are on the pill, this lowers your testosterone. Many women do fine with that. It clears up your acne and or your oily skin. But many women, this actually bothers them. It can affect their mood. It can cause fatigue. It can cause brain fog. And it can absolutely lead to libido and painful sex issues. So if you're on a birth control pill and you're having those problems, it's time to talk to your doctor about switching to something that doesn't cause those problems. Add some kink to your routine. So, many women read 50 Shades of Grey, but they read it in the parking lot waiting for their kids to jump in their car, or they read it, at home by themselves. They didn't really turn it into anything. So this for a while, this was a lot of fun, but now, it's kind of, on the back burner. But if you're interested in any kind of this kind of stuff, there's great websites. One of my favorites is pleasuremechanics.com, and they have a whole course on how to add kink to your sex life. Try mutual masturbation. This has been very interesting in the middle of a pandemic. How do we stay safe with COVID-19? And one of the ways to do that is actually masturbate, but 6 feet apart. So this is one of those things that it's fun to try. You can watch your partner. If you watch your partner, you can see what techniques and tips they're using to help stimulate themselves to orgasm. And then you can try to incorporate those tips and techniques when you do that to your partner. And if things are getting to the point that you're really kind of noticing that they're not getting better, then it's probably time to see a sex therapist. You can find a sex therapist in your website, in your area, by visiting the website for the American Association of Sex Educators, Counselors, and Teachers. I think it's www.aasect.com. But don't think of this as something like there's something so wrong with me that I need to go see a sex therapist. Think of it more along the lines of, I, have some issues and I need to get some help. And I really, don't know much about this topic, so I need to go get educated. And that's really what a sex therapist does. So with that, I'm going to close and see if there are any questions.
Thank you so much. That was incredible. We can also turn our video back on so folks can see. If anyone has any questions, you're welcome to use the chat feature or the Q&A. I guess, one of my first questions is thinking about birth control, because I know that's, a really important topic that doesn't get enough airtime. Maybe you can talk a little bit more about what you were alluding to, the relationship between birth control and potentially lower libido and painful sex, and what types of birth control are we talking about?
So we're talking about birth control that has estrogen in it. So almost every birth control pill out there, combined oral contraceptives, has a very powerful estrogen in it called ethinyl estradiol. And that estrogen gets absorbed by the stomach, goes to the liver, gets processed, and actually it creates a hormone level that binds to testosterone and prevents it from working. So because of that, it lowers testosterone, great for acne, oily skin, not so great for your mood and fatigue and your libido in some patients. So if you want to get off those types of birth control, there's lots of options. We have these birth control, long-acting reversible contraceptives. So those are things like an IUD. An IUD is a T-shaped device that goes into the uterus. We have 5 IUDs on the market now. Some of them have hormones, one of them doesn't. So we can absolutely find the right IUD. We're even putting them in 17 and 18-year-old women because they are so much good. They're so much better than birth control pills with regard to pregnancy prevention, and they don't have to remember to take a pill every day. And then these long-term potential side effects are not happening. There's also a device called Nexplanon that gets implanted into the arm. It's also a non-estrogen containing birth control. And there's actually a pill that you can take that has no estrogen in it. It's not as effective. It has to be taken at the same time every day. So that's one of those ones we kind of reserve as a last resort.
That's so helpful. And I think it's just so important for people to know. I know when I was in my 20s, I had no idea that, that could have been an issue. And so that's really, really helpful. I know there's probably some shyness in the crowd. So if you want to send a question, you can also do it privately just to the panelists. So that way, if you're not comfortable asking directly, but I'll ask another question that I know often comes up. And so, let's say you have a patient who comes to you and says, hey, I've been trying all these different things, but I really just can't orgasm. What's kind of the way that you have that conversation and tips that you might offer to that person?
So generally speaking, most women don't learn how to have orgasm until they're in their late 20s or early 30s. And it's that kind of that myth of the penis is just supposed to go in the vagina and you're just supposed to have an orgasm. For most of us, it takes direct clitoral stimulation, either with their hand or with a toy. And so usually I'm educating first about anatomy. What does your clitoris look like? I'm going to show something that I use all the time. This is a vulva puppet that I use every day. And if you look at your anatomy, these are like your big lips, your labia majora. These are your small lips. Your clitoris actually lives under your clitoral hood. So you have some skin that comes down over this. This is your urethra, and then that's the vagina. But the clitoris is, the clitoral glands is what we see. But so that's tiny, right? But then there's tissue that goes all the way down underneath the labia and all the way back to the bones we sit on. So the clitoris is actually this long. So it looks like a wishbone. And so you can stimulate anywhere along that area, and it can be quite pleasurable for patients. So the first step is kind of educating. I look to see if there are any medicines that they're taking that would affect their ability to orgasm. There's some Sinclair Institute is another place that I send people. They have a video that's very good with how to help yourself have orgasm first. Because that's how most of us have to do it. We have to figure out how to do it to ourselves first, and then we have to teach our partners how to do it. And so if we can go through those processes, usually we can get a woman having orgasm with that. Beyond that, it gets a little bit more complicated. We actually don't have one FDA-approved medicine for women's orgasm disorders, not one. Which is
Yeah. Are you seeing anything kind of on the market and in trials right now? Or maybe you can also just talk through what are you seeing in general in terms of the forefront of clinical research for sexual health?
Well, we actually do have 2 FDA-approved drugs for the treatment of low libido in women. I couldn't say that until about a year ago. There was one drug that was approved in 2015. As of last summer, we had 2 drugs approved. Men have over 20 drugs approved for their sexual functioning issues. And, you know, the disparity there has existed for a long time. And so there are kind of some drugs on the horizon, but it's, you know, it's slow. Like I get asked every day, when is testosterone going to be FDA approved for women? And I'm not sure that that's going to happen anytime soon because it's so expensive to get a drug approved by the FDA. And testosterone is being used off-label by, you know, thousands of women across the world. And so it's even though it's used widely, you know, a drug company has to look at that and go, you know, am I really going to get my bang for my buck with regard to all the money I'm going to have to put into this? Mm-hmm. And so despite that, we use testosterone ongoing with women, but it's likely not likely to be FDA approved anytime soon.
Makes sense, although very frustrating. And I know we have a lot of work to do on the American healthcare system. I'm still waiting. Someone's gonna ask a question in the next 5 minutes, but I have another question. So looking at, you know, the comments you brought up in terms of finding the right provider to get support. And I think a lot of the folks on this call are aware of, you know, the role of PT, but maybe you can speak to, you know, if someone's experiencing sexual dysfunction and wants to get OBGYN support, you know, how does someone choose a doctor who actually understands that, given what you were saying, you know, around the lack of education in medical school? And there's issues, but in general, maybe just talk through like, how can we understand, is this doctor really going to help me? How do I know when they're, you know, maybe advocating for me, or maybe they don't have the right information?
I think one of the first things patients really need to understand is they need to be listened to. So if you go to a practitioner and you say, I have blah, 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 whatever it is, painful sex, low libido, lack of orgasm, lack of arousal, and your doctor doesn't give you a clear, like, yes, this is an important problem, there are things that we can do about it, here's what I'm going to set you up with, then that's the wrong provider. That you got to keep looking, because even in my area, so I'm one of a few sexual medicine experts in all of Charlotte, North Carolina, which is a big metropolitan area. And even so in my area, there's only a few of us, but the providers that refer to me are willing to ask those questions. So you have to be, I tell my providers, I said, you have to be willing to speak sex here. Just because you don't know everything doesn't mean you can't have a conversation and then refer. And so if you're not even getting to the conversation level, that's time to maybe look for a new provider.
And are there any specific credentials that individuals should be looking for when they want to understand what's, if someone's actually a real sexual health expert?
So for ISSWSH, we have a designation called IF. That stands for ISSWSH Fellow. And that means that we go to the meetings, we have a certain number of meetings that we have to attend, and we have a certain criteria that is met in order to get that designation. For the North American Menopause Society, they also have criteria, and they have an exam that you take in order to become a NAMS certified practitioner. So you look for those criteria. Not everybody who is a sexual medicine provider or a menopause provider is certified. That doesn't mean they don't have knowledge. It just means they haven't gone through that process of getting certified. So, and then look for people on their website. People who are sexual medicine, want to speak sex here, they talk about it. They'll talk about it in their bio. They'll say, I treat the following things. And if you're looking for somebody, that's a great place to start.
That's really helpful. Someone in the audience asked us a question, so we can answer one of your questions. But in the meantime, one last question for me. I'd love for you to share, how you've built your new practice, because I think that's actually so interesting and on the cutting edge of how care delivery should happen for women. So maybe it'll spark some passion and advocacy among this group too.
Yeah, so I work for a big healthcare corporation called Novant Health, and I've been with them for about 20 years. And they, a few years ago, said, we really want to put a women's specific center in kind of the area of Charlotte that is the most trafficked. And so they actually, took a building, they redid it, and I'm on a floor that has all women's specific specialties. So there is a breast cancer doctor here. There is a cardiologist who's an expert in women's health. There is an OBGYN practice. There's a behavioral health practice. There's dermatology. And so we have a minimally invasive doctor. We're all on the same floor. And so we can refer to each other or we can collaborate with each other for patients that have specific health concerns. So my new practice, it was funny because when we started, I said, we have to have sex in the title. If we don't have sex in the title, I'm not going. And so our practice is called Sexual Health and Wellness. And the concept is you can get your full gynecology care here. I don't do obstetrics anymore, but you also can get your sexual health needs met. And one of the things I love about my practice is I have these 2 cabinets that sit outside where my patients wait, and they're beautiful, and they display beautiful sex toys and lubes and books. So my patients actually look at that and think, wow, it's okay to talk about sex here, and it's okay to talk about sex in other places. We should be having this conversation on an ongoing basis.
Amen. I totally agree with that. And it's really great. I hope the way that you've developed your practice is an inspiration to others around the country. And to anyone listening too, I think now you're able to treat through telehealth in a couple different states, or where are you able to treat?
Oh, so right now it's in North Carolina and South Carolina. I'm not sure how long this is going to last as far as, COVID with regard to the future, because telehealth may go away. Which is unfortunate if it does. And actually patients should stand up and demand that it doesn't go away, because how much easier is it for a patient to have a visit with a practitioner like this when it's not required that I lay my hands on? So there's a couple of questions. Do you have any information, insight about lichen sclerosus and its effect on sexual dysfunction? Are topical steroids the only solution? So lichen sclerosus is a chronic skin disorder that can actually happen anywhere, but it happens very commonly in the vulva. And it's kind of an autoimmune disorder where your own body attacks your skin cells. And unfortunately, one of the best treatments is topical steroids. It is tracked and proven the best treatment for this disorder. If a person is failing topical steroids, then it's time to look again, like their provider needs to look and make sure they're not developing anything more concerning, because lichen sclerosus does put you at risk for vulvar cancer. But then also kind of reevaluate, do we need to use the steroids more often? Do we need to change how we're applying them? Like I always recommend that my patient either soak in a warm tub or put a warm hot compress against their vulva to kind of, you know, when you go to the facial people, they put the warm towel on you to kind of get your pores to open up. So it's the same concept. Get your pores to open up and let that steroid cream really get into the skin and actually rub it in as opposed to just slathering it on. There are some people that are doing laser treatments for this. There is not data to support that therapy yet, so you have to be careful and cautious about that. It says, next question is, I ran into having a low libido, low testosterone from taking birth control for years. I'm on a hormone supplement of it and estradiol for over a year now, and I'm improving, and my testosterone has gone up, but it's not quite to the healthy level. My libido has gotten better, but it's not where I want it to be. My sexual health doctor is thinking of taking me off it the next month, so I'm wondering what it would be the next step. So I have a lot of patients who I use a combination of testosterone with Addy. So Addy is one of the drugs that has been used to treat low libido in women. I actually had a patient come in today who was on the combination, and she said for the very first time in her life, nipple stimulation created clitoral sensations and arousal. So I like home run. So if your provider has not tried you on Addy, A-D-D-Y-I, then that's something I would recommend adding to the testosterone. I feel like there is a stigma about anal play. How do I get my partner to become more open if I'm interested in trying something new? So you're right, there is totally a stigma with regard to anal play, and I wish we could get rid of it too. So I feel like the best way is to start having a conversation about it. Most women either have this like, oh yeah, I love it, or absolutely disgusted by it. There's kind of nowhere in between. What many of us don't know is that there's as many nerve endings that surround the anus as are in the clitoris. They can be very pleasurable to stimulate. So maybe just start with a conversation about anal play. Once again, pleasuremechanics.com has a whole library of their podcast, Speaking of Sex with the Pleasure Mechanics, and they have a section just specifically devoted to anal play. And so, you know, how do you do it? How do you start it? Tristan Taormino is a woman who's done a sex educator who has several books on anal play. And if you go to Amazon.com, she has a whole guide to anal play. So that's a good way to get started too. And then remember, there's lots of, there's a gentle way to go about this, which is start externally playing first and then go to insertion. Because if you go from, nothing to a penis in there, it's going to hurt almost every person that's out there. But if you gently go from, stimulating externally and kind of relaxing the area, maybe putting a finger in, maybe using a small anal play toy and moving to sequentially to larger toys, it can be quite pleasurable. Great question.
Yeah. That's great. Any other questions from the audience? We have a few minutes left. I'll do the dance until there's more questions.
What are your thoughts on Botox with helping sexual pain? So it depends on what the sexual pain is coming from. So if a person has a musculoskeletal like tightness that they need to have relaxed, then Botox can be an option. I would probably tell somebody first to do pelvic floor physical therapy to, try and get that area to relax initially. And then if we're not getting anywhere, then you could consider Botox. But sure, Botox has been used in a lot of sexual medicine centers, but in pelvic floor to treat sexual pain disorders, specifically if there's a trigger point.
Has that been, have there been clinical trials around that, or is that more?
I think there's one, I don't know if it's published yet, but there are ongoing clinical trials right now with Botox and pelvic floor pain issues.
Great. We'll bring that back to our clinical team too.
Okay.
All right. Well, we'll hang out for maybe 1 or 2 more minutes if there's any other questions, but Otherwise, thank you so much, Dr. Lisa Kelly. Such a pleasure to have you here today. A wealth of information. We'll send a follow-up email with how to find out more about her clinic, as well as the recording from today. And if there's any other topics you'd love for us to address in the series, we'll be kind of doing these once a month moving forward. Would welcome any suggestions. I'm now talking with a Southern accent accidentally. I do that sometimes. So, well, really grateful for your time today. And thank you all for joining us. Really great questions. And I love the openness around this dialogue. I think to your point, we can't just ignore, between our belly buttons and our thighs, in public. So I'm really glad that we're opening up this conversation.
Thank you. All right.
All right. Thanks, everybody.
Very welcome.